Costochondritis Part 2. So we have Ejan here has allowed us to film what he's going through, because a lot of people suffer from this and can't get help. There's really no help for this treatment currently. They give you some anti-inflammatories and send you home typically. And usually the anti-inflammatories work, but then when you get off the anti-inflammatories, the issue comes right back. So what we're doing here is, as we've done with really all our costochondritis patients, is start with laser treatment to reduce the inflammation. And then we want to work on thoracic mobility. So his thoracic spine starts right back here and goes down to about here. So from here to here, we want to work on the mobility of the thoracic spine, because all the ribs wrap around and attach onto that part of the spine. So we're finishing up here with laser for him now. Ejan here, I should have my glasses on. Ejan here suffers from a clavicle injury too, so his clavicle pops up and lateral, up and medial. And he came to me originally with a lot of clavicle pain right here in the sternum, right? That was the original complaint.
It started right in my sternum, and then I noticed that my clavicles were like misaligned.
Okay. So it started in the chest region, in the sternum. It almost feels like chest burn or heartburn.
No, it's more like stiff joint pain. So when I'd like move around and like pull my shoulders back like this, I would sometimes hear my chest crack, like the sternum crack and pop, and that would release the tension. But I mean, it would come right back, essentially.
Right back. So what we're doing is focusing on reducing inflammation with a laser, getting mobility in the thoracic spine. Now we've also adjusted his clavicle on this left side, and the clavicle is the only bone that holds the shoulder to the axial skeleton, and the shoulder is the only joint that goes 360 degrees. So it's the most unstable joint in the human body, and it only has one bone holding it in place. So a clavicle out of position or subluxated could cause shoulder problems and eventually elbow and wrist problems later on down the road. So we want to prevent that from happening. I think costochondritis is bad enough and uncomfortable enough as is. Okay, we're done there. So I've showed in my other videos me adjusting the thoracic spine, and we're going to do that, mobilize the thoracic spine. But we're going to do something else. It's hard to see on video, but his clavicle here, so if you look at my thumbs, his clavicle is slightly higher on the left side. It doesn't take much. It's only a few millimeters that we're talking about here. But you can also see in the chest region here that there's a little bit of like a dipping in the chest region. That means that what's happened here is his ribs have actually pushed a little forward on this left side. He gets most of his tenderness on the left side, but has had some tenderness on the right side as well. Is that correct?
Yeah.
Okay. Right now, we've been treating him for a little while now. He's probably, well, you tell everybody what percentage improvement you say you've seen so far.
I'd say about 70%. 70% of the way. And that's just from adjustments and stretching and stuff like that.
Okay, so he still has some discomfort. Right now he's going through finals, so a lot of extra stress certainly doesn't help. Head down in the book. So we're going to do some mobilization of the rib region here, and I'm just going to have you relax your arm, your elbow and your arm right there. There we go. Okay, and this can be a little bit sore. You just want to have the patient relax the arm. We're just applying some downward pressure on some of the ribs, and then I'm going to go down to the next rib. And let me know if you have any pain at all. Okay.
Sure.
And I'm also applying pressure not only up to down, but from anterior to posterior to try to take some of that rotation out of the ribs. sometimes you'll actually hear a popping or a cracking noise. That's the rib shifting. The ribs are very close together, and there are some small tendons in there between the ribs, and there's also intercostal nerves. And if one of those intercostal nerves is pinched or compressed, it could be really uncomfortable. And one of the ways you can tell that you have a rib out of place, not always, you don't always have to have pain, but one of the ways to tell that you have a rib out of place is when you take a breath in, and at the top of the breath, you feel pain along either the ribs on the side or in the back along the spine, in the rib head region there. Okay, and go ahead and lay on your stomach for me. We're going to loosen up the paraspinal muscles on both sides because the rib heads attach right in here, from here all the way down to about here, and attach right into the vertebra of the spine. So the vertebra of the spine and the ribs have a direct relationship. When one's not moving properly, the other one's not moving properly. And in here, he's got a little bit of a flat thoracic spine. He doesn't have as much of that hunch. Sometimes you see people that have dowager's hump. They're humped over like this. He has the opposite. He has more of a flat back. And often that comes from people that have a straight neck as well. So that's why a lot of times his costochondritis gets worse. You're feeling it down to here, you said? Yeah. So we have 12 ribs from here to here that attach right into the spine, the rib heads. And those rib heads, again, if these muscles, these paraspinal muscles along the spine are in spasm, they're going to pull and tug on those rib heads in positions that we may not want them to, okay? So what we're doing is we're loosening up the muscles here, the paraspinal muscles. We're going to go ahead and realign some of the thoracic spinal misalignments or subluxations. So he said that he was a little sore from, after a treatment he gets a little bit sore the next day. We work on him pretty hard, especially on the soft tissue. Being a student, he's got trigger points here along the top of the trapezius, which don't help him. They help to actually pull his clavicle out of position. So we're going to adjust his clavicle. Is that tender right there?
Yeah.
Okay. So just going to release this trigger point right here. This is also his right hand, so it might be on the mouse all day, right? Do you have this arm on your mouse pad?
Yeah.
So if your elbow is away from your side 10 degrees, just like this, right here, just this space right here on a mouse all day, you're contracting the supraspinatus muscle, and you're going to have trigger points along the top of your shoulder. You might even get headaches or neck pain or shoulder pain. So it's real important to have a good ergonomic setup and make sure your elbows are in at your side, and have your computer desk set up properly. Really important, especially because you're spending 6 to 10 hours, if you're a student, maybe even more time than that. Hang in there, take a deep breath in. This side not as bad.
Yeah, it's not as bad.
Okay, so we're going to now adjust his thoracic spine first before we adjust the clavicle and the ribs. Go ahead and turn over. Actually, hold on one sec, okay? Let me just check your lower back. Okay, go ahead and turn over on your back. And slide down a little bit. Good. Cross your arms in front of you. Tuck your chin down, deep breath in. And blow all the way out. Good, one more. There. Now, okay, now we're going to adjust the left clavicle. Use this thing called an activator. You can also use the hand. Hand tends to be a little bit more uncomfortable, wouldn't you say?
Yeah, a little bit.
More than this is a little bit easier.
Yeah, it's just like 1 or 2, right, and then it's done.
Yeah, it uses speed instead of force to realign misaligned joints. Turn your face to the left. So again, his clavicle is superior and medial. So I'm adjusting it from superior to inferior and from medial to lateral. Okay, head in the center. Now we did some mobilization of these ribs. We're going to adjust them if they still need it. Any tenderness? Or you have some tenderness right there?
No, actually, it's okay.
Good.
Does it still feel like it's popping out?
Yeah, a little bit right there. Right there. So again, we adjusted, and these ribs actually go same way, superior and medial. Okay. We've got him also doing specific stretches to help with his condition. Check your cervical spine now. Any tenderness right there?
Yeah.
Have you had any headaches?
No, not that many. Actually, not at all. I don't think this week.
None at all?
Yeah, but it is tender there.
Okay. All right. So we have a subluxation up here at C1 and C2. You can see him wincing a little bit. It's a little bit tender on that left side. C1 nerve goes to the eyes, the head, brain, can cause headaches. C2 nerve goes to the sinuses. So some people that get a correction there at C2 find their sinuses clear up. Do you have any sinus congestion?
Yeah, occasionally.
And now atlas adjustment and relax yourself here. Okay, go ahead and stand up for me. Check your clavicle again. Good, now it's balanced. Great, all right, all set.
Awesome. Thank you.
All right, let's get into those costochondritis stretches to alleviate your chest pain and mid-back pain. First thing is optional. That's a foam roller. Second thing, which is not optional, is a lacrosse ball. I'm gonna leave links below in the description so you can purchase these easily enough. Now, when you get a chance, just subscribe right below, give me a thumbs up, because all of those thumbs ups and all those subscriptions keep this channel going. We want to create really great content to help you guys. So let's get started. We're going to start with latissimus dorsi stretch. I'm going to do each stretch with 2 variations on that stretch. So this is a latissimus stretch, and with this stretch, the foam roller can be a little intense. It can actually aggravate your costochondritis. So be very careful. If after doing this stretch it aggravates things, stop and we'll do the other version of this stretch. I'll show you in just a minute. Here's how you stretch the lats with a foam roller. You're gonna lay down on your side, put your hand over your head, and you're just gonna roll along the side all the way up to the armpit, keeping your forearm and wrist and hand and elbow on the ground. And you can do that for about 30 seconds to a minute. Do both sides, but you want to focus on the lat, the side of chest pain. So if you have chest pain on the right, you're going to stretch the right lat a little bit more than you would the left side. Now, if this is too intense, or if this aggravates your chest pain, you're going to go ahead and do another stretch standing. It's the same stretch, it's a lat stretch. You'll do it standing. It's real simple. You're going to push your body against the wall or the door and put your hand above your head, and you'll feel that stretch right in here, in this muscle right here. And to get an extra stretch, I'm going to grab onto the door jamb right up here, and I'm just going to hang off of that a little bit, and that'll pull and give me that extra stretch that I need. That's a really great lat stretch. It's a little bit gentler than the foam roller stretch. Now we're going to get into the pec stretch. The pec stretch you can do a couple of ways. First, you can do it at a door or in the corner of a wall. You'll put your elbow at shoulder level and step in, and you'll feel that stretch right across the chest. Now, some people that have costochondritis get an increase in pain here when they do this stretch, because you're pulling the ribs away and forward a little bit. So this can aggravate the chest pain a little bit for some people. If that happens, there's a few other ways you can do it. You can take this lacrosse ball and you can rub it like this right into the muscle, and you'll feel some tenderness in there, and you can even roll it right into the chest and the rib cage area in between each rib, in this direction like this, in a downward slope like this. And again, it's going to be most tender right in this area, right before you get to the armpit area. Another way to do this stretch is to go ahead and put the ball right in that area and lean against it, either a door or a wall. You just move around in a circular motion or side to side to loosen up the pec major muscle. I suggest doing one of the latter with the ball if this hurts or increases your chest pain while doing the stretch. You should only feel the muscles stretching in this area right here, in the armpit or axilla area. And the last stretch, this is a really important one. You're gonna use this lacrosse ball and you're gonna stretch the muscles, the rotator cuff muscles, in between the shoulder blade and the spine. This is a normally really hard area to stretch. In fact, there are really no stretches that can get in there and stretch as good as this lacrosse ball. The only stretch that I know of that comes close is taking your hand, putting the back of your hand on your lower back, and pulling your elbow forward like that. But you can also do this same stretch with a lacrosse ball and get in there even better and really loosen those muscles up. I recommend doing this after some heat or some electric stimulation. So let me show you where we put the ball and how we stretch. In addition to the stretches we just went over, you can also purchase a few other things that'll help a lot. Number one, an EMS unit. They're also called TENS/EMS units. They're slightly different. You don't want to purchase just a TENS unit. You want to get a TENS unit that has EMS on it. I'm going to leave a great link below in the description for a good unit you can buy. And what you'll do is you'll place the electrodes or the pads in certain spots, and those spots will help to alleviate muscle tension, relieve muscle spasms, and reduce muscle adhesions to alleviate your costochondritis chest pain. In addition to a TENS EMS unit, you can also purchase an ice pack and a heating pad. You would put the ice on the chest to reduce the inflammation and put heat on the back in between your shoulder blades to bring more blood flow and relax the muscles. I hope this was helpful, and again, please subscribe, give us a thumbs up, and hope to see you guys soon.